So obviously we're here to ask questions about a plethora of things, but
Yes.
we're going to commence by showing like what we've got with us at the moment. So Sen is in the year above, so
Yes.
he has started up several initiatives such as the Tiffin Journal of General Medicine, where prospective students write about perhaps undergraduate degree level medical issues and anatomy, etc. Then we have the Tiffin Anatomy Society. Like last week we went through some dissections, did some dissections, and then Sen has his own Medicaid UK, which is a charity he set up.
Yep.
And the purpose of this interview is to ask questions mainly about you, your training times, your routines, what your medical school was like, etc., and the wide spectrum of opportunities that you can get postgraduate degree. And I'm not sure if someone wants to start the first question.
So yes, the question that we will be asked to interview is, why do you want to do medicine? May we ask, why did you want to do medicine?
You can do. I mean, it's always a difficult question. It's quite a nice question to ask in an interview, and for two reasons. There's number one, it gives you insight into the candidate and their reasoning behind something, and also it's a nice soft opening for people, just like now. So the reason I went into medicine is that I was always interested in trying to understand how the body works, and I remember as a little child looking through some of those pop-up books. Remember the pop-up books that you have, and they've got the lungs there and they've got the abdominal organs there, and you can open them up and they're 3D. And I remember thinking, well, what's around the abdominal organs? What is it air inside there? Do you have liver and then air and then stomach, etc.? And it was just questions like that. So I got quite, that was essentially one of the main questions I had, was what was around the abdominal organs. And I didn't have Wikipedia in those days to easily Google it, but that was, understanding how the body worked was the reason that I went into medicine, essentially. Medicine, as well as it being an excellent degree, and if you ever decided to do anything else, then it's something great to fall back on.
Sure. Right, and having attended Imperial College London, where you did your intercalated BSc and of course medical degree, and since we're both prospective medical students, could you perhaps tell us what you found particularly and most notably enjoyable or beneficial about the Imperial College training experience?
I mean, great college, and internationally regarded as one of the best top colleges in the world, particularly for medicine, and it's brilliant on so many different levels. Number one, academically, which is why you're going there. You have not only fantastic facilities, but also it's tied in with some of the best teaching hospitals in the country. So you've got your preclinical years with great academia, and then your clinical years, you've got brilliant experience in fantastic hospitals. So it's got those two things. The next thing is it's tied in with all the rest of Imperial College. So your ability to develop new innovations and to really create things is just fantastic, and really it's trying to push itself forward now as a main leader in that field. So it really is fantastic from that point of view. You've got your physics and engineering and all the other things there. Really fantastic college. And then on top of that, you're in one of the greatest cities in the world. I've made lifelong friends who I'm still very, very close with. So if you get the opportunity to go there, take it. It's just a brilliant place. I can't recommend it enough. Brilliant.
Do you have lots of research opportunities in there?
Yeah, you've got lots and lots of research, and even more nowadays. When I started, it was Imperial College was just in its just starting. So Imperial College Medicine was just starting, but really the opportunities there for research and academia just excellent.
So have you heard of the Robert Steiner unit?
Yes.
I was spent some time there, and their facilities are absolutely fantastic.
Yeah, I mean, really,
it was astounding.
And then if you wanted to walk around, you go to Hyde Park and the Science Museum and everything else on your doorstep. It just is a wonderful place.
It's a big choice, Oxford or London.
And and if you have to, you could always choose Oxford and then move to London for your clinical years. But I just think preclinical, just excellent. Really is brilliant.
Oh wow, okay. I'm going to cut right to the chase here, but What made you pick neurology and neuroscience during your medical?
Good question. So I'm a neurosurgeon.
Neurosurgeon.
But that's exactly the right question, because, as I said, my reasoning for going into medicine is almost exactly the same reason for going into neurosurgery, but as you put it, neurology and neuroscience, because that's what I really loved. So actually, a lot of my questions about how the body worked were answered pretty early on. I mean, obviously, at the end of it all comes down to biochemistry and physics and atoms and all the rest of it, but on a global scale, a lot of how the body works we understand. And I began to be fascinated on how the mind works, and that's really what took me into neuroscience, was how the mind works. So I kind of answered my main questions about how the body works, and the next question for me was how the mind worked, and that's really what took me into neuroscience. And then I considered neurology or neurosurgery, neurophysiology, neuroradiology. There are certain aspects to my personality. I like to get answers. I like to. I'm a doer, so I like to, try and help people. I like to find solutions, and I love theatres. So a lot of those all led me into neurosurgery rather than to neurology or neurophysiology and all those other things. But it is exactly right the way you phrased it.
Whilst at medical school, did they give you a lot of opportunities to see surgery and research?
Yes. So I did a neuroscience BSc in my third year. Just the opportunities were fantastic.
Right.
Just fantastic. And I was involved in, back when I did medical school, this is one thing for you guys to learn, is how bright and excellent you are. So I remember being in medical school, and we were taught very, didactically, that the thought process then was that neurons do not regenerate. And I was thinking, well, hang on a sec, every single other cell in the body regenerates, and you're saying that none of the nerve cells in the brain regenerate and none of the supportive tissues in the cell regenerate? That cannot be right. And so I got the opportunity to do research in something called an oligodendroglial cells, which are basically the insulating cells around nerve cells in the brain and the neural tissue, which are affected in MS and so forth. And sure enough, we showed that they do actually regenerate, and there is these things. You just have fantastic opportunities. So take everything that you're told with a pinch of salt, and believe in yourself and believe in your beliefs, and you'll go far. You'll go far.
And talking of opportunities, and especially for our readers who are quite intrigued, what a postgraduate of medical school, what international opportunities do doctors have? Because obviously, correct me if I'm wrong, but I read up you went to Montreal.
Yes, I had the opportunity there, and I also went to Sydney.
Yes.
So I did my fellowship in Sydney. Essentially, it is a great degree. So yes, you can go into medicine, but you could leave medicine. It's hard because it's such a fantastic subject to do, but people do, and you can go into business, and you can go into absolutely anything, and you can use your skills around the world. So the difference between medicine and, let's say, law is that you have the law, you've got international law, but basically you've got law in this country, and then France will have a different law, America has a different law, Australia has a different law, and yes, your skills are transferable, but medicine, people are people wherever you are. So you can go on to Médecins Sans Frontières and you can treat someone in Azerbaijan or down in Liberia, or you can go to America, or you can go to Australia, and people still have the same bodies. The diseases may be slightly different, but it's a great degree that you can go anywhere in the world with. You really can, and particularly if you have the opportunity to be trained in somewhere like Oxford or London. There isn't a place in the world that doesn't regard that highly. So you'll be highly regarded.
I noticed that many surgeons do spend some time abroad.
Yes.
What were the benefits of spending time abroad?
I think that it's always important, whatever you do, to get a broad experience. Okay. So because it teaches you that there is not one way of thinking, that there are other ways of doing things. And what you see is that there are institutes in whatever you work in. If you work in science, if you work in art, if you work in literature, whatever you work in, there are institutional cultural cultures. And so if you move out of those institutions, and even within nationally you have one culture versus somewhere else, you get more, it broadens your horizons, and it broadens your ability to think laterally and to see what other opportunities there are in the world and other ways of treating things in my career. So it really does expands your horizons. You know, so enables you to think, I think, truer. It gives you a truer kind of vision of the world and what you're dealing with. That's my belief.
And it brings a bit of change into your life as well.
Yes, absolutely. And changes it's always good.
Wow.
It's always good.
That's great. What part of surgery, if there is one, takes like the greatest toll on you mentally, physically, emotionally?
It's a very good question, and I think that what people often think about is, when you're doing long surgery and you're concentrating for a long time, but actually it's not the hardest part of the job. The hardest part of the job is the decision making. Taking all of your experience and your knowledge for that person and to understand that person's needs and what's right for that person. Because essentially there's no way of telling the future for one individual, and you can have all the literature in the world and all the knowledge in the world, but you really don't know the future for one individual. And so essentially what you learn with experience is to be able to amalgamate all the information you have and to use that to try and tailor your treatment for your patient in front of you. And so that, your decision making is the hardest thing, but it's what I enjoy. It's the enjoyable part of it.
Yes, and as I did some research about your training and specialities, you cover a wide spectrum of things: neurosurgery, neurology, stroke, vascular neurosurgery, for example. Which and what about that service do you enjoy the most?
It's a very good question. So the vast majority of my work, as I've said, is spinal work. The vast majority of spinal work, because that's the most common thing. So back pain, leg pain, arm pain are the most common things. And it's an absolute privilege to be able to look after people and have the skills to be able to diagnose the problem and then be able to get them better. And it's an absolute privilege. But at the same time, we have that variety, and I specialise as well in brain tumour surgery and vascular neurosurgery, so in cranial surgery as well. And that is just fascinating, absolutely fascinating. And again, to be able to improve people's quality of life, extend their life expectancy, and at the same time to further my understanding of how the mind works and take that all into account. It's a beautiful privilege. It really is. It really is. And and again, to see the truth of the world around you. We're very closed or protected, I suppose is the right word, in our culture at the moment, in particular in the Western world, from sickness and illness. And you don't see that, as you go around your everyday life. And it really is a privilege to be able to understand that, we're very fortunate. The well out there are very, very fortunate, and to be able to look after people and get them better is a real privilege. It's a great, great career, I have to say. Great career.
So you mentioned that as a neurosurgeon, there are a lot of responsibilities that you have.
Yeah.
Could you possibly say or tell us what your role entails, as well as in surgery?
So there are lots of aspects. So if I break it down into the clinical aspect, the academic aspect, and the managerial aspect, are broadly those three aspects. So the clinical aspect is obviously seeing patients and looking after them and getting them better. And as I spoke now about spinal surgery, cranial surgery, tumour surgery, and vascular surgery. And a proportion of that time, probably half of that time, is actually consultation and seeing people and explaining their diagnosis to them and telling them about the various treatment options and so forth. And then another half of it is actually operating and so forth, and looking after them on the wards and after and before their operations. And that's the clinical aspect of it. And then you have your academia, so research and your teaching, research, all of that aspect of it, and then the managerial aspect of it, so you're making sure that everything for your patient pathways, as we call them, flow through the hospital, that they've got access to the facilities that they need, and looking at a more broader spectrum of what the patient's needs are and so forth. So lots of different aspects to the job, but
It must be very busy.
yes, keeps you on your toes. Keeps you on your toes.
Right, and do you feel, as a very knowledgeable person in your field, and having practically reached the peak of your career, that the studying process of having to learn and absorb knowledge is still evident and part of your life?
Yes, absolutely. That's the whole point of doing this. That's the whole point of doing it. That's why I went into medicine. That's why I went into neurosurgery. Is because the things we don't know. It's the possibility of to continue learning. That's what I enjoy.
And
that's my, like I said, the reason I went into medicine is because there were things I wanted to understand. There were things I went into neurosurgery, things I wanted to understand. So that ability for lifelong learning is just joyous.
Yeah, I was just going to ask, do you think a doctor should be learning all his life?
Yeah, absolutely. Yeah, absolutely. Yeah.
So I noticed in neurosurgery the importance of the multidisciplinary team. Could you tell us a bit more, just in case our readers are not too sure about it?
Okay,
How
so that's
important
to
it
you,
is.
the readers, or the people watching the video. No, so there are many aspects to a neurosurgical patient, and obviously the operation is just one aspect of it. But there are many different things that a patient needs. So, for example, from our simplest surgery, such as, I don't know, someone with a nerve which is trapped down in the hand, to someone who has a slipped disc. Afterwards, to try and get them back to their everyday life, they will need ongoing kind of inputs, so physiotherapy, someone to talk to them, explain them, what exercises they can do to try and prevent this coming back again, looking at lifestyle factors to try and prevent this coming back again and get them as healthy as possible. So you've got all of those side of things. So that's physiotherapists who look at those movements and so forth. Occupational therapists that look at how someone lives at home and look at what they do for a living and how their home situation can be optimized. We deal with neurologists who also work very closely with other conditions, so things that need tablets to be treating them or other injections to treat them. We work with cancer specialists, oncologists, so that after we take out someone's brain tumour, if they need further ongoing chemotherapy or radiotherapy. We work very closely with the radiologists, so when people have the scans, that we make sure that we're interpreting the scans in the right way. So it's a whole team, and obviously, of course, the nurses and all the rest of our colleagues that we work very closely with every day. So,
and I noticed, well, what's work experience with the 8 a.m. meetings?
Yes, yeah.
They're very useful, aren't they?
Yes,
For patients,
absolutely.
so everyone knows about the patient.
Yeah. And to discuss, there's the axiom that you don't know what you think until you've said it. So to think through your thoughts is very important, to try and verbalise them. So if you've got a difficult case, to be able to verbalise that with your colleagues, get their input on things is very, very helpful. Very, very helpful. If I can recommend a book to any of you, it's called something called Thinking Fast, Thinking Slow by the Nobel laureate Daniel Kahneman, who's an economist, and I recommend that to everyone to read. It enables you to, just the difference between intuition and an immediate thought process, between standing back and having a little slower thought about things. And it basically shows you some of the faults in human cognition and the way we think, which again is an interest of mine.
I guess very good. And being a consultant neurologist and a neurosurgeon at the same time, can you describe to us like what a day is like or a week is like, being in your shoes?
Busy, keeps you on your toes, keeps you interested. So I've kind of generally gone through that a little bit. We tend to, wake up at 6:30, something like that. Go to the ward, see a few of our patients. Then we have an 8 o'clock meeting, which is a teaching meeting where we go through all of the admissions overnight and go through that with all the rest of our team and one or two of the radiologists as well, and make a plan for it. And then you'll move on at 9 o'clock, you'll have your clinic, or 8:30 you'll have your theatre start, and either you spend the day in theatre or you spend on the day in clinic, or you'll have occasional managerial meetings or multidisciplinary team meetings, and keeps you on your toes. And then after you finish your hard day's work, you get back home and you eat something, rest, and then back to work the next day.
Yes.
Do you feel that doctors get any or maybe a lot of free time?
Yeah, it depends on what you do. So yes, and it depends on your you know, what's important in your life. A lot of people that go into medicine have that drive and like to be stimulated, and so a lot of them are workaholics to an extent, and you know, just love working. But you do have that ability to spend some time with your family, and so it's not one of my greatest fears going into medicine was that I wouldn't see my family at all. And certainly, you know, I don't see my family as much as some other people, but in any hard working profession it's the same. You know, so whether you go into the city or you go into medicine or whatever, you're running your own business, it's the same.
Sure.
You know, we all work. With me and my colleagues and my peers that don't do medicine, I think we all work on a parity, really, depending on what you want to do in life.
Yes. I think Henry Marsh's book Do No Harm is quite a good representation of the challenges you may face.
Yeah, absolutely. It's great.
You did mention that sometimes you had to wake up in the middle of the night and go and see patients at a time.
Yeah.
Is that something that you've had?
Yes, you do, certainly. You know, you do take your work home, but as I said, I think in all career where you're passionate about what you do, you'll take your work home, and yeah. So, you know. And like I say, I see it as a privilege. I see it as a privilege to truly see the world around me as it is. You know, that's how I see it.
And I believe this is quite a hot topic when it comes to the writers and readers of the journal. What ethical values and / standings do you hold when it comes to surgery, your profession, and how does your daily life relate to the legal system, in the sense that...
Okay, that is an excellent question.
Right.
It's an excellent question. It's a very broad question.
Yeah, sorry.
And essentially the take home is, I think that if you are looking after a patient the way you would look after your brother or your sister or your mother or your father, you're looking after their best interests. So you've always got to ask that question: is this what I would do for my next of kin, for my family? You know, is that the right thing? But at the same time, you have to balance it against the patient's point of view, and you know, the patient's wishes and the patient's beliefs. So you have to balance those two, because obviously the patient may have totally different beliefs to your family.
Yeah.
And so it's gauging from the patient what their beliefs are, and it's a discussion with the patient. From the legal profession, I think your question was also, so that's the ethics behind it, and that's a simple answer, is that if you just do something which is patient's best interest, and the way to gauge is what would you do for your family and what would you advise for your family, and then you have a conversation and a discourse with the patient about what they would wish you, so you put your point of view and then you listen and see what their thoughts are about this. Your question also hinted, though, at the medical legal side of things, and you know, it is a concern. I think that I've certainly gone through my medical career always having that in the back of my mind, and I'm always expecting to end up in, you know, with some medical legal complaint. It hasn't happened to me as yet, but you know, I think everyone expects it. It's an expectation that it will happen, and it really does take its toll, and it takes its toll on doctors, and I think that's probably one of the hardest things. And I'm not sure we've got currently the balance right in this country. Certainly 50 years ago the balance was too far in favour of the doctors. I think at the moment it's swung the other way, and there are excellent, eminent surgeons with years of experience who are fastidious, and I know are brilliant trainers. And I know personally people that they have trained who have said that they were just excellent surgeons. They have no problems them looking after any member of their family, to the degree that, you know, the surgeon was there absolutely every minute of every day and involved in absolutely every operation, and would be very hands-on and not really let his juniors do too much because he's so hands-on. And this is one particular surgeon that I'm thinking of that has ended up in jail for manslaughter for a patient who had a very, very, very severe illness with a 50-60% mortality, if not more, and the patient unfortunately died because he had such a significant illness, and this doctor has ended up in jail for manslaughter.
So much knowledge wasted.
You know, and that is just a travesty, and unfortunately we are seeing it more, and that is a real concern. It is a real concern. A real concern.
I believe in America the occurrence of legal complaints are much higher.
It is.
People paying for their treatment.
It is, but we're moving that way. We are moving that way, and you know, having good doctors end up in jail for manslaughter is
not the best of routes.
Yeah, you know, and it's not a culture that you want for your essentially it's not a culture that you want your doctors to be in. But the balance was, too far towards the doctors 40 years ago, and so at the moment we've swung too far that way, and hopefully we'll get a balance in the years to come. Hopefully.
Current dilemma going on is about junior doctors. Their pay.
Hot issue.
What are your opinions on that? Because you do.
I've got little doubt. I think it was summed up beautifully recently is that in the UK currently we have a socialist system for the bankers and a capitalist system for everyone else. So essentially that means that if you were to pay for your operation on the open market, you wouldn't pay a tenner for it, which is what people are currently getting for it. Now, I personally think the NHS is absolutely an amazing thing. It is the most efficient health service in the world, bar zero, internationally recognised as probably the top medical system in the world, but it has a massive debt, and one of the things I was very sad about at the last election is that no one wanted to talk about it. And all the parties were saying how much more money they were going to say, and we're going to give an extra 8 billion for it, and just kind of failed to say that actually we're going to give 8 billion, but it's 30 billion in deficit. It's already the most efficient health service in the world. You're going to say you're going to make efficiency savings of 30 billion in something that's turnover is 100 billion, so you're going to make a third efficiency savings on the most efficient health service in the world. That's not viable. That's not viable, and essentially it doesn't have the funding it needs. The politicians can't say that to the public because they're not going to get voted in. The only cuts they can make are on doctors and nurses' salaries. They can't cut back on hospital services, they can't cut back on equipment, so the only cuts they can make are in salaries, and it essentially needs a zeitgeist paradigm shift towards something else, but the public is not ready for that, and so the politicians won't give it. Personally, if I was going to run a health service, I've been in Australia, and that's how I'd run it. So they've got an excellent public health service in Australia, and they've also got a good private system where you have rebates for insurance, so if anyone earns over 50,000 Australian dollars, so over 25,000 British pounds, so that's your tube drivers and so forth, there's a benefit to having insurance, and that means that the money is coming into the system, and that you're able to fund the public system appropriately. But the British public are not ready for that yet because they see it as privatisation of the NHS. They don't want to pay for things twice, and so we're not there yet.
Would you consider free healthcare as would you consider the public thinking of free healthcare as a right in this country?
Yes, I think it is. I think it's a privilege.
Yeah, it is a privilege.
It is a privilege, but I think that we can't lose free healthcare at the point of delivery. I would hate to work in America where you have people that aren't treated appropriately because they don't have insurance and not enough money.
Exactly.
That is awful, and I think that's absolutely despicable. Personally, I would hate. I love the NHS and I want to protect it.
It's quite hard.
But we can't do that yet because we haven't got the money for it, and no one. We can't afford it at the moment, but the public and the politicians aren't ready for that discussion yet.
I can understand this is perhaps a really broad question, so take your tangent as you do. Can you let our readers know what is the most rewarding thing about being a neurosurgeon?
Yeah, I've already said it. It's looking after the patients. It really is the privilege of being able to look after patients and to explain to them, what's wrong, what's happening, and to make them better. It really is absolutely a privilege, as well as my academic, fulfilling my academic interests in understanding how, pathophysiology of disease, of spinal conditions, of the way the mind works. It's amazing. It's amazing.
Have you got any more questions?
One last question, yes. You're a surgeon. Would you recommend, and why would you recommend that fellow aspiring medical students go into surgery and not into research or be a physician?
Oh, I don't think there's a right or a wrong. I think you do whatever is right for you. I really do. Like I said, you know, when I took that period when I was doing my neuroscience BSc, and over the next couple of years at the end of medical school, to think, who am I? What do I really enjoy doing? What am I really good at? And how am I going to combine all of that aspects of my personality to achieve my goals and maintain my happiness, and to be that platonic best citizen that I can be.
Yeah.
And so for one individual, there's not a right answer. Right. You have to work out for yourself during, you know, in your journey, what makes you happy, what are your skills, what do you enjoy doing. At the same time, I would say that whatever you choose, if you go into it with great gusto, you'll enjoy it. You know, so I think if I could easily have chosen a different path and ended up going into research, going into neurophysiology, and I'd have loved it, you know, and I would still be the same person, still be working hard, and I'd be loving it. So, you know, we're a very privileged position. Yes. We really are.
I did mention that was the last question, but one very last question. Let's say, you know, an aspiring medical student, what qualities would you want to see in them?
Enthusiasm. Enthusiasm, intelligence you need, obviously, but enthusiasm is probably the greatest thing. It really is. So if you're enthusiastic, you're hardworking, you're intelligent, and you're bright, you're self-critical. I think that's a real part of intelligence, is being able to work out what you can't do and how you can make yourself better in that sphere. So self-directed learning, being self-critical, but enthusiastic and personable as well. Sure. You know, if we're talking about, but you're saying for medical school, so there are lots of aspects to being a doctor, and you can like, you know, be someone who's on the front line talking to patients, or you can be someone back in the lab. So, but you know, if you're enthusiastic, you're hardworking, you're bright, good at talking to people, then you know those skills will take you far.
Can you extend on the personable?
Personable, just to be able to interact with other people.
Oh, in that sense.
Yeah, interact with other people. Yeah.
Thank you.
Well, thank you so much, Mr. Laban.
All right,
it's been
no problem.
a pleasure
joy.
to interview you, and hopefully our readers will enjoy the articles that we'll write, and they'll enjoy the video, hopefully too.
Well, I wish you all the best in your careers in the future.
Thank you very much.
Thank you.
Right.
Thank you so much. Right, thank you.